So very good evening, everybody. We have Dr. Sandeep with us. We have Dr. Meenal with us. And I'd ask Dr. Sandeep to take over, and I will mute so that this echo stops. And both of you could continue. Good evening to Dr. Sandeep. Good morning, Dr. Meenal, and welcome. And Murli, thank you for organizing everything.
So thank you, Pramila ji, for making all the arrangements and facilitating this meeting. And thank you, Dr. Meenal, for attending this meeting so early. Good morning to you. I heard that it's around 7 a.m. in the morning. So
thank you.
We are also thankful to Mr. Murli for all the technical support. So Dr. Meenal, let us start without wasting any time. Is it okay with you?
Yes, go ahead.
So as you are aware that, first let us have your introduction, Dr. Meenal. Kindly for our audience, have your introduction.
I am Dr. Meenal Shukla. I'm board certified in internal medicine and America, and I'm practicing in New York City, basically for last 20 years. And my patients are from different age groups with different medical problems. And I also teach medical students. I'm affiliated with NYP Methodist Hospital, One Brooklyn Health, and Brooklyn Hospital. I also participate in local seminars for the patients in India and abroad for obesity medicine and also with preventive medicine. So those are my specific fields, because I strongly believe that instead of curing the disease, preventing disease is the key for health all over the world. Thank you.
Absolutely. We are honored to have you, such a accomplished doctor. And just probably I missed two important things for our viewers, that you belong to Rajasthan.
Yes, definitely. Rajasthan is my home, and I belong to Rajasthan from my heart.
And you have a keen interest, and your practice also involves treatment of patients, as you say, the important aspect, that is prevention and treatment of cancers of the body, and especially abdominal cancers like pancreatic, esophagus. Am I right, Dr. Meenal?
Yes.
That's great. So now let us begin our talk. And for the viewers, I would just like to introduce the topic of our talk today with our expert, international expert, Dr. Meenal. It's about the prevention, early detection, and timely treatment of abdominal cancers. The idea of this came almost 15 years back during my practice, when I noticed that a lot of Indian patients comes to us in the last stage of their cancers. And this actually bothered me, because when I see myself, I have spent, like any other doctor, 15 years in this field to understand, to gain knowledge and expertise to treat them. But only out of 100, only out of 20 out of 100 were treatable. So, I found it so wasteful. My knowledge and technical expertise, that 80% I am unable to do anything about. So when we searched the cause behind it, we found that it is the lack of awareness among people, that the symptoms of the abdomen, they don't have any idea of the connection between those symptoms and the possibility of it being a cancer. So the third step I took was, I started looking for world literature, and I was really surprised to see that this problem is not India specific, not poor specific, not any specific strata of the society. It's across the globe. You can have financially well-off people, educated people, developed nation people, population, or developing nation like ours. Everybody is having the same problem. So we founded a Abdominal Cancer Day in 2019, and we observe it every 19th of May. And this is the fifth extension of the same program, and a build-up program about that. So Dr. Meenal, tell me about your experience in your abdominal cancer patients' practice. What do you see in terms of their patient delay or in how much time average do you think your population which you serve takes when it comes to abdominal symptoms for them to take a first medical consultation?
Dr. Sandeep, as you mentioned that these cancers are diagnosed at a very late stage, and in America also recently, I think they changed the guidelines for screening colon cancer to age of 45, because most of these cancers are asymptomatic. Patients don't have any symptoms, and by the time they reach to doctor's office, it's already too late. And sometimes the symptoms are very vague, like heartburn, or it is just like a stomach upset, diarrhea, constipation, abdominal cramps, and they don't only ignore for a few days to weeks. Some patients are ignoring, even in New York City, when there's so much of awareness, they are ignoring it for months and years. And it is really sad that even when they reach the primary care doctor, it is like the cancer is in advanced stage. And believe me, every month I'm diagnosing 1 or 2 cancers, and in younger patients, like in age group of 40, 45. And I really strongly believe that what they did with the guidelines is very much needed in America. And I think the same way it is happening in India, the westernization of the culture is predisposing people to colon cancer, and it is one of the most common cancer, like third most common cancer, if I remember, in the world, and the third most lethal cancer. So I think it is a very good initiative on your part to have a day dedicated for colon cancer screening or awareness of people for abdominal cancers, because what I would like to emphasize, besides colon cancer, liver cancer, pancreatic cancer, stomach cancer, all the intra-abdominal cancers, they make the major bulk and are influencing the longevity and the health of the people around the world. So we should all try to make people aware that they are very common, they are preventable to some extent, and early detection is the key to fight this major disease of the world.
Absolutely right, Dr. Meenal. And as you have rightly pointed out, there are three peculiar problems about abdominal cancers, and people often can think, what is so big deal about abdominal cancers? We have much common diseases, which are taking lives every day. And I mean, how come the abdominal cancer reached that stage where we can, think about it in terms of public health problem? So for the viewers, I must inform them that abdominal cancers are actually now have become a public health problem for 3-4 peculiar reasons. Number one, its incidence is significantly rising, and the data shows us that more than double incidence is going to be there in the next 10 years. Second point is that out of 10 most common causes of cancer deaths, 6 out of those 10 are abdominal cancers. So as a group, it becomes the commonest cancer causing death as a group. And for us to understand that abdomen contains 7-8 organs, but for a person, the symptomatology is not going to tell whether this symptom is because of pancreatic cancer or colon cancer or some other abdominal cancer. They all arise in the abdomen. So we must need ourselves to be sensitized, taking abdomen as an individual organ, so as to connect those atypical symptoms to the possibility of cancer. Third important point is that, as you rightly mentioned, that this cancer incidence is increasing very much in the younger population. In fact, as per the US data, before 1990, the majority of GI cancers or abdominal cancers were in the age group of more than 60 years of age. But now, 25% increase in incidence is there between the age group of 25 to 60 years. And that is significant, because this is the productive age group. Fourth point peculiar about abdominal cancer is they initially present in a very, very atypical manner. The symptoms are very vague and trivial. And all those symptoms are also commonly seen in benign diseases. So people mistook them as a normal day-to-day, like, it's a normal kind of thing with the body. It's not, they don't take it as a possibility of a lethal disease as cancer. So because of this, we must need to get an awareness and about the possibility of a link between these trivial symptoms and cancer of the abdomen. So, Dr. Aminal, tell me about your, as you started with cancer colon and rectum, so let us start our discussion from that organ. We see quite commonly that patients with rectal bleeding, they often have initial treatment for weeks or months together, considering it as a files problem rather than a cancer problem because of inadequate testing. So, what is your opinion about it, and what is your experience about it?
So means most of the cancers are asymptomatic, but if you have any symptoms, and even if it is the slightest of doubt, you should definitely go to a physician. If not the specialist, at least to your primary care, let them examine and make the decision, because bleeding is a very alarming sign for any cancer, and pain or constipation, even constipation for the left side of the colon, if it is involved, it's a common symptom for cancer. And also, if there is pain in the abdomen, like right side abdominal pain, that is a very common presenting symptom for the right side of colon cancer. So don't ignore these symptoms. They can be very subtle symptoms, but they are very important. And you might think it is normal, but it is worth going to a physician, let them examine and clear you. Yes, 80% time it's nothing serious. So don't be scared that, oh, when I'll go to the doctor, they're going to say it is cancer, and I don't want to hear that. But at the same time, if you go and they diagnose you with cancer at an early stage, your life will be saved. So that is very important. You are not as professional, and I think for these type of symptoms, because the cancer is on rise, you should.
Dr. Meenal, I think, am I audible to you, Dr. Meenal?
Yes, I can hear you.
Okay, okay. So you are absolutely right that the important, every symptom needs to give a proper importance. We should not ignore any of them, considering, we should not be judgmental about our symptoms, that they are trivial and we should not be doing anything about them. And as you have rightly mentioned, the rectal bleeding is often considered as a people, just think that it is just because of piles, because it is a much commoner problem, and they just ignore the possibility of any cancer behind that bleeding. So we were discussing about the importance of screening colonoscopy, as you have already mentioned. And as for the audience, the initial limit of age was beyond 50 years in US, but they have reduced it to 45. So you can understand the importance of screening colonoscopy with regards to cancer of colon and rectum. So Dr. Meenal, now please let us know about what do you think about the link between the lifestyle and the abdominal cancers?
Lifestyle, yes, definitely is a key factor, because as we are moving to more westernized diet, like non-vegetarian food, high temperature cooking, like barbecues and frying foods, and less fruits and vegetables, as well as less fibers in our diet, more processed food. Everything is adding, because it affects the gut microbiota, and in turn, there are carcinogens generated in our body, and that is predisposing to colon cancer and liver cancer. Smoking and alcohol, another thing, like though smoking is on decline, like because it's not considered that fashionable in any part of the world anymore, but still, like, there are different ways people are smoking, vaping, tobacco smoking. So all these things, and even industrial like pollution, is to some way contributing to these cancers, and we should be very careful. Alcohol, people used to think is safe, but according to recent guidelines, they're saying alcohol consumption is also dangerous, especially if it is moderate to heavy. And especially in liver cancer, we have to be very careful. So I think everyone should understand that anything besides natural food is toxin for our body. If God wanted it, it will be growing on the plants or trees. So we should never, means we cannot always avoid, but we should try to avoid and make other people aware that it's not good for health, and not encourage like fast foods and fried foods and unhealthy foods to go inside our body, because that is one thing that is very simple to do and it can avoid so many problems down the road.
Absolutely. So, very well said, Dr. Meena. I would like to enumerate for the benefit of the viewers all the risk factors. It starts from your choices, be it alcohol or smoking. Any amount of alcohol or smoking is harmful to you, and either in short term or long term, you are going to see the consequences in terms of suffering, in terms of deadly diseases like cancers, and some diseases are also there which are equally deadly as cancers, even though if they are not cancers, like pneumonia, bronchitis, all those kind of problems. Second is choice of diet. Broadly, vegetarian diet is a safer diet, and non-vegetarian diet broadly is carcinogenic. If you want to further specify upon which type of non-vegetarian diet, so it's basically red meat and meat cooked in high salt and with high temperature, as you have mentioned. Thirdly, it is lack of physical activity, which is also an independent carcinogen as far as abdominal cancers are concerned. No matter if you are having a normal body weight, but if you are physically inactive, that doesn't make you safe as far as abdominal cancers goes. You are having a higher risk of getting these cancers in comparison to a normal weight person who is physically active. Next is obesity. Obesity in itself is another carcinogen factor, and it's totally our own doing. People always give an alibi. Either they say maybe it's my thyroid or maybe it's my genes. It's nothing like that. Genetics is the wiring, and our habits are the switch. So we may have the connection of electric current in the way of wiring, but until and unless we switch on the habits, that wiring is not going to get us affected. So please remember, your habits are the reason what you are going to get in life, suffering or health. And as Gautam Buddha has said 2,500 years back, it is so relevant even today that every person is an author of his or her own health or disease. And it is so true even today. Next is our infections, like in terms of hepatitis B or C, which are carcinogenic, specifically for liver cancers. Then there are few autoimmune, like ulcerative colitis, Crohn's disease, which are in true nature genetic diseases. Autoimmune diseases, we don't know actually the origin, but they are having an unknown etiology. But definitely our lifestyle in terms of less stress, no stress, makes a lot of difference in the exacerbation of these diseases and the effect of medical treatment. And air pollution you have already mentioned, and there are a few pre-malignant conditions which, if we are diagnosed with, we have a duty towards our own health, that we must get ourselves checked frequently, at least annually, with the doctor to see whether any malignant change is happening in that disease or not. What are those pre-malignant conditions? Like starting from esophagus, gastroesophageal reflux disease, which we commonly call as GERD, Barrett's esophagus, echinacea cardia, gastric polyps, gastric ulcers, large gallbladder stones, uh, polypoidal lesions, polyps, like especially adenomatous polyps in the intestine, ulcerative colitis, and colorectal polyps. So, friends, if any of these diseases are there, please get yourself checked on the regular interval to prevent yourself from getting cancers diagnosed in the late stage. So, Dr. Meenal, these are all about the pre-malignant conditions and our lifestyle reasons behind these cancers.
Mhm.
Now, coming to the symptomatology. So, please make our viewers aware about the common general symptomatology behind these abdominal cancers.
So the most common symptom is no symptoms. That's why the screening guidelines are so much emphasized, especially in US. We are means judged, the doctor's performance is judged based on how frequently they are following the guidelines, and colorectal is one of the top diseases in check. So I think we are all asked to send our patients at age of 45 to get the colonoscopy done or some kind of screening, whether it is a stool occult blood or Cologuard or sigmoidoscopy. And the thing is, symptoms develop in few people and they are generally very late and they are very vague. So main symptoms are anorexia, that means they have lack of appetite, they feel weak because of anemia or something. That's how they generally present. They can complain of constipation, which is a very common symptom for, means in old age, constipation is like an aging process, but it can be something serious like colon cancer or mass in the abdomen, and we have to be very careful about it. Then diarrhea with constipation alternating, or diarrhea by itself if is possible. Sometimes there can be bleeding from rectum, and it can be fresh blood, it can be dark blood, even small spotting at times. We have to be very careful. There can be growth coming out from your rectum or anus, and people ignore it as hemorrhoids and they think it's something, they had it for some time and they ignore it. So that is also very common. What else? These are the common symptoms. And generalized abdominal pain, it's not very specific, like you cannot pinpoint what is the problem. You have to do the tests and screening, and that's how you can diagnose it. Even doctors need some more like additional testing before confirming what is the cause of the problem.
Absolutely. So the message, friends, Dr. Meenal is giving, that all these symptoms which you must be already witnessing in day-to-day life can be the symptom of the cancer inside, undetected cancer inside. Now comes the question. So if they are so vague and atypical, then how does a common man understand when he or she should be attending a doctor, or when or he should be suspecting a cancer behind these symptoms? Because they are so vague. They are very commonly seen in benign diseases also.
See, what I personally feel, age is a very important factor. Like when you are 40 plus, you have to be very careful because your body is changing. And when the body is changing, the cells are changing. And that is the time most of the cancers develop. That is between the age of 40 and 65. So if you are developing new symptoms, and second thing, body speaks for itself. You will not have any symptoms without a reason. So if you are having any symptoms, you have to be very watchful. And if it persists more than a week or 2 weeks, then you really have to see what needs to be done. You cannot ignore it. And if it is happening intermittently for a period of time, at least a month or so, definitely most of the cancers are silent in the beginning, and it is important that we go to a physician, let them examine and do the necessary testing and confirm that there's no cancer. It is the key to prevent cancers and increase your longevity. Otherwise, you can take a chance and most likely it will be good, but in the end, you can hear a news that you have a cancer and you're too late to get any treatment. And that's, I think, nobody would like to do.
Absolutely, Dr. Meenal. So the most important thing Dr. Meenal has advised, that these definitely are a very, very atypical in nature. They are very vague, and they by itself doesn't mean that you are definitely having cancer, but their nature, their duration of persistence, if they are persisting beyond 2 to 3 weeks, despite proper treatment, you are getting them again back, again and again. That means you need to check with the specialist to undergo few tests to know what is the cause of those symptoms, because they may be atypical in nature, but they are persistent. So if the combination is there of atypical symptom and they are going within a week or 2 weeks time, then probably there is nothing to worry about. But beyond 2 to 3 weeks time, if they are persistent, then you must not waste any more time, because if unfortunately somebody has a cancer behind the reason of those symptoms, and you waste time beyond 1 month, the chances of getting it metastasized is very high. So the key is to diagnose this cancer within 30 days of onset of symptoms. For that, you have to be very conscious, very, very cautious in your approach. These symptoms Again, I am repeating, if they are beyond 2 to 3 weeks, you must need a doctor. Another reason is that if they are persisting, even if they are not cancer, the reason is not a cancer, there must be some other reason which needs attention and treatment, because it is not only cancer which can lead to loss of life. All the diseases have the potential to cause risk to life. So we must not ignore for these two reasons. So Dr. Meenal, tell us about the basic idea for our patients, basic understanding, the kind of test they must be aware of, just the names which we often get our patients undergo to diagnose these cancers. Just in brief, for their general understanding.
Okay, we can do like a basic stool test if there's no family history of cancer and there are no symptoms. That is guaiac stool occult blood test. We can do immunochemical fecal testing. We can do Cologuard, and we can do sigmoidoscopy in doctor's office. We can also do capsular endoscopy if somebody is afraid of going through a procedure. They generally give a capsule and it has a camera and it goes through your GI tract and take pictures. It is available in big hospitals, but it is non-invasive test for people who really don't want themselves to be exposed for these procedures. And colonoscopy is definitely the gold standard because you're putting a camera, taking the picture of the gut, and if there are any polyps, you can just take them out and biopsy them at an early stage and diagnose if there's any cancer, or at least assure the patient that there's no cancer and they can be followed in next 5 or 10 years.
So, Dr. Meenal, now we have just 2-3 minutes left, and I wish you to give us some take-home message so that our viewers, they get benefit out of this presentation of yours, this talk of yours, to imply and implement this in their daily practice.
So take-home message is abdominal cancers are definitely on rise and one of the most common cancers worldwide. They are very asymptomatic in the beginning, and even if the symptoms are there, they are very vague. So if you are having any symptoms related to your gut, whether it is decreased appetite, weight loss, abdominal pain, bleeding, any minor symptoms that persist for more than 2 to 3 weeks, please go to your doctor, let them examine you, let them do the necessary testing. Even if it is not cancer, it will help you to diagnose the underlying disease. And if it is cancer, it will be diagnosed at an early stage, and it is our way to fight this battle against abdominal cancer.
Thank you, Dr. Meenal. And I would like to add to the significant message of Dr. Meenal that, friends, just don't get afraid from this word cancer. If any of us, our family members, friends get this diagnosis, cancer, it is as treatable as any other disease. The only key or deciding factor between it being a treatable disease versus non-treatable is what delay the person has, how much delay the person has given from reaching out to a doctor after the onset of symptoms. So it is actually in our own hands. So take charge of your health, and we can at least prevent ourselves from dying of abdominal cancers. Thank you all very much. Dr. Meenal, thank you for your time. And it's good to know you as an expert and to connect with you. Thank you so much. Pramila ji, thank you so much.
Thank you, Dr. Sandeep, Dr. Pramila, and Murli ji for putting it together. And it's my pleasure to be with all of you on this episode. Yeah, thank you.